Mississippi Live from the Element Well Studios. Joining us now, Dr. Joe Johnsey, Chief Medical Officer of Relias Healthcare, and Dr. Eric Jordan, Site Medical Director, Forrest General Hospital Emergency Department. Doctors, thanks for coming in today.
Thanks for having us.
Yeah, so first, Dr. Johnsey, tell us about Relias Healthcare. I read a bit about your story. It's fascinating.
Yeah, we're one of the fastest growing companies here in the state. We provide medical services with a number of hospitals all across the state of Mississippi. Kind of grew out of a need to help out there at Tupelo, where we're based out of. The hospital there, going through a difficult transition with the former group that was there. The CEO of the facilities just said, hey, we need some help with transition here. Can you help us out? I said, absolutely.
Seems like that's starting to get traction as more of a trend in the healthcare industry, where especially larger healthcare institutions are starting to outsource, for lack of a better term, some of these services. Is that true?
Well, I think there's always been there are a lot of moving parts in a hospital.
Sure.
There are a lot of things that administrators have to deal with, and I think that there's only so many balls you can keep in the air, and having folks that you can help to partner with to deal with some of those issues. You find somebody that you feel like you can have some confidence in, that can be a strong partner. That's who you want to work with, you want to associate with, and deal with those issues where you need to find somebody to help manage part of that operation. So yeah, I think that's always part of it, and whenever you find that right partner to deal with that portion of it, then they're going to reach out and do that. And so
right.
we've certainly found more and more needs in our particular niche here lately, where especially with the other issues that are going on with nursing shortages and the like, that, hey, we don't need to be dealing with this particular part of the staffing matrix as well. So can you help handle that for us while we're worried with other issues that are going on?
Dr. Jordan, explain your relationship with Relias.
Yeah, I know you were saying outsourcing, but I don't feel like I was outsourced. I'm actually a native of Hattiesburg.
Sure.
And so I work for Relias. I've been with them for 3 years now, but I'm local. I just happen to be the representative there at Forrest General. And so I've been able to be there for 22 years. Mm-hmm. And so when people come in and get their health care from Forrest General and come in my emergency department, they're going to see a familiar face, local.
Right.
It's actually rare that I work a shift that I don't care for somebody that I grew up with, or their children, or their parents. I took care of some folks last evening on my swing shift that I go to church with. Mm-hmm. So it's a good fit.
Gotcha. So we hear a lot about, I think the average person does, about emergency rooms being backed up and there being long wait times, and seems like most of the medical institutions, the hospitals in general, attribute that to just a staff shortage as much as anything. Is it a combination of a physical shortage of beds and other assets? Is it a staff shortage, or is it a combination of both?
There are so many moving parts. I'm not sure we have time to discuss all of them. So the short answer is yes, you're exactly right. But when you come in, there are so many things that you're dependent upon to get good health care, and it requires x-ray, other services, lab, so staff certainly. With all those moving parts, everything has to be firing on all cylinders for it to work smoothly.
But I think we went through with COVID, and the easy answer is always COVID nowadays, you know. But we did. We went through where normally you'd come to the hospital and you need to be admitted. You stayed for 4 or 5 days and you went home. And then when you wound up needing to be in the hospital for COVID, you stayed for 2 weeks. And so the hospital wound up backlogging with a lot more patients staying for a whole lot longer. And so the beds in the hospital wound up being occupied a lot longer. People backed up into the emergency department. And so patients who usually came in and needed to be admitted, they left in an hour or two after they needed to be admitted. They wound up staying in Eric's emergency department for 2 or 3 days, sometimes waiting for that bed upstairs. And so, yeah, there weren't those beds now when you came in with an emergency to go and be examined and treated in the emergency department. So we had to figure out over that past 2 and 3 years how to take care of patients in a whole different way, in a whole different space, and it looked a lot different for patients.
Yeah. So what's the value proposition? I'm a hospital, and I've got an emergency room, and I don't have your company involved in operating that for me, the suite of services that you provide. How do you pitch them? What's your value proposition?
Well, I think we're not a one-size-fits-all.
Okay.
And so that's the big thing that we want to say is you've seen one emergency department, you've seen one emergency department. And so the one solution that somebody might bring is probably not going to be right for your hospital. And so we want to come and learn about your emergency department. We want to come and learn about what Eric knows about his hospital that he's been at for that long, and we want to adapt, and we want to evolve to what is going on. We want to evolve to the pandemic that has changed the way we practice medicine. We want to now say, okay, I know we used to take care of this in this particular space, but now we're going to have to take care of this in a chair in the waiting room. Right. And so let's do it differently. And I know we're used to taking care of this with a doc in this place, but now we're going to have to use the rest of our team, and our nurse practitioners are going to have to stretch their skills to the top of their licensure, and we're going to have to adapt and evolve. And, maybe you're in a small rural hospital somewhere, and you can't afford to have the physician be there in person. So we're going to have to train up a nurse practitioner or a physician assistant, get them some better skills, and we're going to have to work remotely with a physician to help back that person up. And so that's what we're ready to do, is to say, give us your problem, and we want to come up with a solution to fit what that problem is.
Healthcare, of course, like everything else, is highly specialized, and it's there are a lot of moving parts, as you say, and the human body is complicated. How do you accommodate all the possibilities that might show up in an ER?
That's a great question. That's part of the reason I went into emergency medicine. I guess it was a good fit because I have ADD almost. I like controlled chaos is the best way I can put it, and every day is different because you don't know what's coming through that door. Yeah. It's not a routine office practice where you see a lot of the same stuff. Yeah. So to answer that question, I think you have to constantly be adapting and comfortable with change. And one of the biggest things we were able to do at Forrest General, I don't know what they did everywhere else, but we made our waiting room another zone of our emergency department.
Well, I heard you just say you might be treating somebody in the chair.
That's exactly right. Instead of acting like usually you would check in. If there wasn't a room in the back, you sat in that waiting room. However, during COVID and with this crisis, we ended up treating that just like another zone in our emergency department, and put a provider out there, started working to get labs done, did x-rays, would send them to the x-ray department and have them come back to the lobby because there still wasn't a room, and then calling them back into a different room when we got all of their results. And that way we were still able to flow and accommodate people and render care with limited space.
Wow. Awesome. So looking at your history there, Doctor, it seems like you've had a very positive trajectory of growth. I mean, it's really exponential. Dr. Johnsey, do you anticipate that that's going to continue?
Well, I could never have imagined that we'd be where we are today. So I don't know that I can imagine what tomorrow will bring. Sure. We're ready for whatever the next challenge is. I certainly think that when you're facing some of the crisis that some of the facilities, especially in our state, are facing, they're going to have problems, and they're going to need innovative partners to come bring solutions to try and solve those crises. So that's the right recipe for us to be there. Yeah. So I would predict that we're going to have a lot more people that are knocking on our door.
Is the focus presently, though, on providing these services for ERs? for emergency room operations?
Emergency departments, hospital inpatient services, and anywhere else that folks see the need.
Do you want to hang around through the break and help us understand sort of the state of healthcare and healthcare delivery in the state of Mississippi right now? It's a hot topic, as you know, across the country, not just in the state of Mississippi. If you guys can hang around, we'll talk about that further.
Be happy to.
We're in the Element Wealth Studios. We're coming right back. Stay with us. We are in the Element Wealth Studios. We're having a chat with a couple of physicians, Dr. Joe Johnsey, the Chief Medical Officer at Relias Healthcare, and Dr. Eric Jordan, Site Medical Director for Forrest General Hospital Emergency Department. So the state of healthcare has always been obviously a major issue from a policy perspective, an economic perspective, and just the incredible dynamics that have shaped care, innovation through the years. But it's become, it seems like, more in focus of late because we're seeing lots of reports where hospitals are struggling financially, not just in Mississippi, and there's been a great deal of focus on that, certainly at the state level from our legislature and other interested parties, but nationally. I mean, I've seen reports lately where the Cleveland Clinic, the Mayo clinics, they're losing money. They're upside down. And I think most of their patients are reimbursed with private coverage, which is supposed to at least keep you in the black financially. This is a big problem, is it not, in the state, in the country? You guys got any thoughts on that? What are you hearing in the industry? Who wants to take that?
Easy questions, please.
I'm not sure what the right answer is unless our insurance companies have cut so much on what they pay for that it was so lean before the pandemic that coming out of it, there's just not a way to turn a profit. I understand that they're in business to make money too. They're also supposed to be in the business of providing insurance for people's health care needs, and maybe there needs to be a focus on that and some legislature work that gets us better reimbursement for these hospitals to survive, providing these same services.
It's unique to this industry, is it not, that there's another party paying the bills for the most part. The customer, which is essentially the patient, equivalent in another business or another style business of a different model. But in this case, you've got a third party for the most part that's paying the bills. And then there are multiple third parties that all pay at different rates. The payer mix, I think, is the terminology used in the industry. And you look at the revenue section, because I've done that, of some of these major institutions. It's complicated, it's perplexing, and it makes you wonder, how do they fit all that together to make ends meet?
Yeah, the way we came about with the economics of healthcare is really confusing, and no other industry faces it the way that healthcare does. And if anybody, I mean, when you wind up seeing your hospital bill, and if you look at what the charges are, you get induced another heart attack after you get treated for the one you came in for, thinking that's what you're going to wind up owing.
Yeah.
And everybody who's submitting those charges knows there's no way in the world I'm getting anywhere close to 25% of what those charges are from anybody, the insurer or the patient or anybody whatsoever. But we wind up, because of this weird system that evolved in healthcare, we have to submit these trumped up charges to generate the bill to begin with, to then have them discounted 75, 80, 90% to wind up getting to actually what we're going to collect in the end. Just there's no other industry that's like that. And so just starting from that idiocracy that is
good way to put it.
You know that things are just plain foolishness, and we ought to wipe things off and start over to something that really has some sort of common sense basis.
Well, as a consumer of healthcare, we all are for the most part, I have a hard time just figuring out who I owe and how much I owe them. when you get all those explanation of benefits and the bills come out of the wazoo and you don't know. And sometimes they're 3 and 4 months after the services have been rendered. And you all of a sudden get this surprise bill, so to speak. And you may or may not owe that to whomever it says you do. And you wait for something different.
And the code doesn't explain to you, a layperson,
I don't know what in
the world that was that someone did to you or might not have done to you.
Yeah. As a physician, I can't understand the explanation of benefits that comes in. So,
It's crazy. So I just wonder where all that's going. It seems like we've complicated it further, and the goals in some of the policy making was to simplify it. I don't think we achieve those goals at this point. But there are a lot of concerns in the state of Mississippi. We've got 122 is the number that sticks in my head, hospitals, I guess, what are deemed the various categories of hospitals fit into one of those categories. And that's a whole other subject, of course. And that there have been reports from Dr. Edney, Department of Health, that a large number of rural health care institutions are upside down financially. Now, that number has receded somewhat. It started out at a higher number than it came in at when they sort of updated the reports. But it's still too many, and there's still a lot of them that are upside down. And we could give them some one-time money, as our legislature is talking about doing, but that's not going to permanently solve the problem. We have a lot of unreimbursed and under-reimbursed services at the end of the day. We're going in that direction on the revenue side, and on the expense side, you got a shortage of labor, which is driving those costs up. I mean, this is the economic dilemma, is it not, in the healthcare industry?
Yeah, and we just gave it a shot of adrenaline through COVID on that expense side for sure. To say that what was already it was a grocery store margin kind of game to begin with, where these hospitals were eking out 3% margins maybe to then try and reinvest in facility renewal, and now you closed that, or you flipped it into negative margins real quickly, and then you went through the COVID surges, and you had labor rates that doubled for these places, and man, there was no way they could ever cover that sort of thing. So yeah, they struggled. Whatever reserves they wound up having, or whatever tax base they could tap into, just got obliterated very quickly for those small hospitals that never had much in the way of some sort of a reserve. So those are the ones that are going to go away. And the sad thing is, those rural hospitals, those really small hospitals, they're in the really small towns, and they wind up representing usually the largest or second largest employer for that community.
Right.
And so on top of providing health care for that community that probably doesn't have another place to provide health care, they also provide a large number of the jobs for that community and the good paying jobs for that community. So the ripples of what a closure of that hospital have, directly on health care, but they're going to echo for a lot of other people as well.
Well, the obvious way to resolve the personnel shortage is to get more people in the industry, in the practice of medicine. What are you hearing from young folks? Do they have an interest in this, or are they seeing all the problems and saying I think I'm going to choose another career path?
I think you see people that are still interested in the industry.
Okay.
My
practicing medicine.
My oldest child is entering nursing school,
okay.
So I don't think that it's that. I think that the idea, unfortunately, of sticking to Mississippi is we're still having the brain drain out of Mississippi, unfortunately, and we've got to stop that leakage of the best of Mississippi outside of Mississippi.
Couldn't agree more, and that obviously doesn't apply just to health care as just a practice area, but it's really across all the various disciplines. We've got to do the same. We've got great universities and college that turn out fantastic talent, but also often they either don't want to stay here when they graduate, or we don't have a place for them.
That's right.
Yeah.
And the more we can retain them, I think the better off the state would be overall. And it doesn't matter what the area of practice is or the profession is in general. Are you concerned, either of you, that we are going to see the imminent closing of some of these rural hospitals in the near future? I mean, Dr. Edney seems to think is imminent.
I think it is. I think we're going to see a number of those hospitals in the next 18 months that will no longer have their doors open, unfortunately.
Yeah.
Hate to see that because they're like you said, there are a lot of byproducts, negative byproducts of a closure of a healthcare institution. Besides the rendering of care, of course, they're often the largest employers in the area, and they do a lot for the community as well. They're usually good community stewards of the hospitals in these areas.
Sure.
So appreciate you guys coming on. Enjoyed the conversation. Thanks.
Thanks so much.
Thank you.
Coming right back in the Element Well studios. Stay